Everybody, we will go ahead and get started. I know this seems silly, but I've been told to talk into the mic, even though this room is small and there aren't as many people, because they are recording this. So um, I'm not used to a mic. My voice is pretty loud usually. But good morning. My name's Austin Lucas. I'm the program director at the Ohio Suicide Prevention Foundation. Just a little bit about our organization before we really jump into things, just to let you know a little bit about who we are, what we do. We are a statewide nonprofit organization that serves all of Ohio. Our primary function is to provide suicide prevention resources, programs, events, trainings. We do a lot of advocacy work as well, all across Ohio. We serve all Ohioans. We have a lot of trainings and resources for mental health professionals in the field. Some examples of that are, some professional development trainings, suicide risk assessment training, zero suicide trainings. But we also provide a lot of training and resources for just everyday people in the community. And we work a lot at the local level too, local suicide prevention coalitions across the state. We've actually done a lot of work with the Ohio program for campus safety and mental health as well. And we do a lot of advocacy. We are involved at the State House, and we like to take the local voices across the state and let their issues be heard and known at the state level as well. All right, so what we're going to talk about today is implementing an interprofessional suicide prevention course. The Ohio Suicide Prevention Foundation, through a SAMHSA or Substance Abuse and Mental Health Services Administration grant, back in 2015, we were awarded with this GLS grant, which is a youth suicide prevention grant serving youth between the ages of 10 and 24. I know that there are campus GLS grants as well, so you might be familiar with those. But this was a state level grant that the Ohio Department of Mental Health and Addiction Services actually, kind of signed off and allowed for the Ohio Suicide Prevention Foundation to apply on behalf of the state of Ohio. So just a little bit, yes.
I hate to interrupt the flow. Was the sign-in code?
They didn't tell me any. They didn't prep me with any of that, actually. Oh, here we go. It's in my folder. Like I said, they didn't tell me any of this stuff. This is what it looks like. 79DRAB.
What's the other?
AB, as in boy.
Thank you.
Yeah, you're welcome. I'll go ahead and pass this around. I have a few of these copies. I only have two, it seems like, but I think the evaluation is this QR code as well. But I'll just pass one on this side and then one on this side and go around. You're welcome. All right, so a little bit about what we're going to talk about over the next hour or so. I want to start off actually right after this slide, just kind of having a conversation in this room about what resources and initiatives, programs, trainings, so on and so forth, that your respective institutions implement in terms of suicide prevention specifically. Just for my own knowledge, but also for you all to collaborate, talk with one another in the spirit of this conference, right, which is breaking down silos. So we will go ahead and do that right after this slide, but then we'll talk about that interprofessional suicide prevention course that I had mentioned. We'll take a deeper dive into that course, what that looks like. Just a sneak peek, it is a semester-long course, actually, that we are able to fund the creation of out of this grant. And then we'll talk about how your institution can actually adopt this course and all the materials actually completely free of cost. And then we'll talk about how do you actually maintain fidelity to the course, with respect to the original developers of the course and maintaining fidelity, how it was originally implemented. If you decide to, or if you're interested in implementing this course on your campus, we will talk about, again, how do you maintain that fidelity to receive the best outcomes for the students. And then we'll have a just, again, open discussion, Q&A at the end. All right, so this is where we're going to talk with one another. So just, it'd probably be best if you talk to somebody that was not from your institution, right? Because this, this probably wouldn't be that helpful because you probably already know what resources are on your campus. But if you could find somebody in the room and just, pair up, talk about, specifically which suicide prevention resources that your institution is offering in terms of suicide prevention. So, we'll talk about, education. So training. So training for students, training for faculty, staff in terms of suicide prevention. This could look like different gatekeeper trainings that are happening on your campus, like QPR, mental health first aid, just some examples there. But also advocacy work too. Is your institution involved in suicide prevention advocacy? Does your institution have student-led advocacy groups in terms of suicide prevention or mental health? Is there administrative buy-in for these advocacy groups and these student-led organizations? Are there any kind of postvention activities going on your campus? And if you don't know what postvention basically is any kind of service or resource after a suicide loss. How your institution responds to that suicide loss. Are there any policies in place, any resources in place for that? And promotion too. Is there Are there campaigns on your campus in terms of suicide prevention? And we heard in that opening video there about some of the grantees' work as well. So just keep in mind similar kind of resources when you're sharing with one another. And safe messaging too. Are there appropriate safe messaging resources around suicide prevention on your campus? So again, we'll just take about 5 minutes, just talk with a partner around the room, and then we'll kind of report out again, just for me to know who's in the room and what resources are going on. And afterwards we can connect, and I can, if the Ohio Suicide Prevention Foundation can be of a resource or of help, we can have that discussion at that time too. But I just think this is a good activity just to kind of break the ice, even though I hate icebreakers myself. So sorry to put you through this. But anyway, we'll just take 5 minutes. All right. Thank you, everybody. We'll come back together now. So thanks for taking just a few minutes to talk about which resources, programs that your campuses are implementing. So now I'd like to just kind of share out just a little bit about what you all talked about, just again for my own knowledge about what's going on across Ohio and how OSPF can be of a resource to you all, but also just for you all to hear about what's going on. And maybe you can learn from another institution, hear about some new resources, trainings, programs, so on and so forth. So we'll just kind of go down the categories here and just kind of shout out anything that you talked about, any particular resources. So in terms of education, so again, the gatekeeper realm, QPR, mental health first aid, so on and so forth, trainings like that. Are there any courses, any seminars around suicide prevention? So what did you guys talk about? That's great. The Columbia Suicide Severity Rating Scale training. I have not heard any institution doing that, so maybe others are. I just haven't heard of it. So I know that we've offered that through the Ohio Suicide Prevention Foundation just to a broad general audience. But that's great that you're offering that to your abnormal psych students. Anybody else? Awesome. Yeah. In terms of QPR, thank you, by the way. How, and other trainings too, how are you all promoting those to students? Is it kind of is there any kind of mandatory activities, or is this like, hey, we're offering this QPR training, sign up if you'd like to, or is there extra credit involved in certain classes? Just curious how that's going. Great. Thank you. Kent State, did you know that your institution is actually implementing this course in the fall that we're about to talk about?
What's the course?
The Interprofessional Suicide Prevention course. Okay, yeah. Well, this is good still for you because you'll hear about, what's going to be happening on your campus. But yeah. All right, we'll switch gears just in the interest of time to advocacy. Any kind of student-led advocacy groups across campus? What do those look like? Anybody? And is there buy-in from the administration? What about promotion activities? Campaigns. I've heard that already. But any kind of safe messaging campaign. We'll just combine the last two here. So any resources on safe messaging, again, using the appropriate language when talking about suicide, resources on, again, how do you just have that conversation appropriately and effectively? Or stigma reduction campaigns, any of those activities going on? Sure, that's what we've heard as well from various communities across the state. All right. Well, thank you for indulging in this little bit of an activity with me just to start things off. I just think it's good, again, to get to know a little bit about which resources are being implemented across the state in terms of higher ed institutions, and just to, again, get to know each other a little bit more. All right, so we will transition into talking about the actual suicide prevention semester-long course that I talked about, but also want to talk about the suicide prevention plan for Ohio and how this course fits into that. So back in 2019, Ohio realized we did not have a suicide prevention plan for the entire state. We actually found out that we were the last state, the only state in the country that did not have a suicide prevention plan. So the Ohio Suicide Prevention Foundation, in collaboration with the Ohio Department of Mental Health and Addiction Services, as well as 32 other diverse stakeholders across the state, actually came together in mid 2019 to develop the very first ever suicide prevention plan for Ohio. And there are five strategy areas. We actually just wrapped up this first edition of the state plan at the end of 2022. We're actually working on our new suicide prevention plan as we speak. But anyway, there was a specific goal in this plan in terms of higher education. And it was Ohio will concentrate efforts on integrating suicide prevention practices and suicide care, including postvention, into high impact systems, including healthcare, public safety, and education. And education here is both K-12 and higher ed. We did have a separate higher education kind of focus group. Actually, Jessica Zavala, that you heard from this morning, she actually was on that committee. So the specific goal for higher education was to promote the adoption of core education and training guidelines regarding suicide prevention into higher education curricula of health professions. And this was specifically talking about that interprofessional suicide prevention course that we're going to talk about extensively here, and how to, again, integrate this into other campuses across the state. Again, this was initially funded out of a SAMHSA GLS state grant, and we actually contracted with the University of Cincinnati, as well as Old Dominion University and the University of North Carolina at Charlotte, to develop this course. It actually went a few rounds in the development, and they wrote a research article on it, on its efficacy, effectiveness, right? And the resulting course materials were then given to the Ohio Suicide Prevention Foundation to consult with other universities and campuses across the state in implementing this. So again, the performance measure was to market this course, right, and do basically what I'm doing right now, talk about the course, and have other institutions adopt the course by the end of last year. Again, happy to say that Kent State is actually the first institution that is adopting this course outside the original developers. So we're really excited to see how that goes. And we have a marketing video that we'll show you too, just a little bit of an overview of the course before we really dive into this. All right, so just a little bit of a background about the Interprofessional Suicide Prevention course. Why did we fund this initiative? Why did we fund the creation of this course, the implementation of this course? Because I'm sure that most of you already know that most counselors, mental health professionals, so on and so forth, do not get specific suicide prevention education when they're going to earn their master's degree. They do not, it's not required when they get their license either to receive ongoing continuing education specifically for suicide prevention. Obviously, counselors, psychologists, social workers, so on and so forth have to go through the CE, continuing education, but it's not required for specific suicide prevention courses, right? So for these reasons, this is why we decided to fund, and we believe this is the first of its kind specific, again, semester-long suicide prevention course for both undergraduate and graduate students learning together, as well as a background, in terms of like majors that would attend this course, right, or fields of study. It's anybody that's going into the helping professions, and that's broad for a reason. We want to foster collaboration with these folks before they actually enter the field so that they know how to collaborate with one another effectively when they're in the field. So it's all about learning about that prior to launching into that field of work. But again, funded out of SAMHSA grant. Again, the University of Cincinnati implemented the course. The Old Dominion University implemented the course, and the University of North Carolina at Charlotte implemented the course. Obviously, it was developed, right, best practices through the literature, and it was offered in a variety of formats across this 3 year period. And actually, it's still ongoing at the University of Cincinnati as well. Yes.
So what level of course, I mean, is there one set for grad students and then another one for undergrad?
No, sir, it's actually combined. Like, we actually encourage.
So if we offered it, I mean, is it something that's, could be offered at community college level?
Yes.
Okay.
Yeah, absolutely. Yeah.
Called like a 2000 level course?
Yes. Yeah. It can be implemented at, and I'll go into this a little bit about which type of institutions, basically any higher education institution, community college, even technical colleges, major universities, smaller private universities, all of the above. But again, it is like a semester long course, and we'd like to stick to that semester long kind of framework. But again, it was offered three formats: in person, blended, or hybrid, right? And they were ahead of their time. They created, the virtual hybrid kind of formats prior to COVID. So that worked out great during COVID. But what they found was that in-person courses, obviously the outcomes were better for in-person learning, just because this whole course is all about collaborating with one another, the students collaborating on projects in class, right? But it is okay to implement in the hybrid model and the online version as well. All right, so what is interpersonal education, or IPE, as the original developers referred to this as? So the definition is it's an education model where students studying in the healthcare, social work, or any other related field learn together about a particular subject. This is suicide prevention. The goal is to cultivate a collaborative process for a more patient or client-centered workforce. So again, that is one of the core components of this course. We'll go into some of, there's some foundations for interprofessional learning as well as suicide prevention, and this course merges the two together. All right, so I kind of already answered this already, but again, what types of institutions can adopt the course? Well, again, it's kind of all of the above here, right? So public 4 year institutions, associates, colleges, private not-for-profit, private for-profit, community colleges, technical colleges. Again, kind of all of the above can adopt this course. And what types of students? And these are just some examples, right? So it can be very broad, and we actually really encourage a wide variety of different types of students, different types of field of study, right? So, some of the obvious ones, right? Counseling, social work, psychology, health profession students. So, you can even have medical students if you wanted to. Nursing students, right? Public health, medicine, ethics, law, nursing, other relevant professions. Again, it's just the helping professions. And, the more diverse the group is, I would say the better in this case. All right, so here's just kind of a basic overview of some of the major topics. We'll kind of take a deeper dive into like the syllabus and actually the course content itself, just to give you a little bit of a flavor of what that looks like. But an overview, there's going to be some foundational competencies in suicide prevention, right? We'll start, it's kind of like the 101 level, right? To introduce the concept of suicide prevention, right? Stigma, just what is suicide prevention, some resources out there, right? Safe messaging, how to have that conversation with somebody about suicide. But then it gets more in depth as the course goes on. There's some community-based competencies. So this is that primary prevention and postvention. So this is kind of, um, that community level suicide prevention, right? It gets into social and interpersonal and at-risk group competencies. So again, targeting just a smaller subset of individuals who might be more at risk based on risk factors, right? And they talk about risk factors, warning signs in this course. And then also that clinical and individual competencies or tertiary prevention. So individual one-on-one when you're talking to somebody, or you're working with a client or a patient, right? What are some best practices there as well? And it goes into suicide risk assessment, right? How to conduct a risk assessment. Definitely the Columbia's mentioned. I remember somebody brought that up. So, what are some key findings? So, the original developers, again, University of Cincinnati, Old Dominion University, and the University of North Carolina at Charlotte, after they implemented this course over a few years, they decided to do a research article on this, right? And what they found was not surprising, but it is their great results is that the interprofessional suicide prevention course demonstrated sizable gains in suicide prevention related efficacy and knowledge, right? Students learn more about suicide prevention and how they can better serve those in their community, better serve the patients and clients that they would be working with one-on-one. Increases in perceived ability as well to help self-harming patients and those who are at risk for suicide. Prevention knowledge and beliefs that persons dying by suicide possess characteristics consistent with depression and isolation. And also, these aren't all the findings. These are just like kind of the big headline findings. Is that participants express notably high intent to engage in best available intervention and prevention practices and draw on the best available public health practices and participate in interprofessional teams. So, again, students do recognize at the end of this course, there's a pre and post test, that it is better to work together, and they recognize the importance of working together with other related fields of practice. All right, so before I dive a little bit more deeper into some of the topics here and the competencies in this course, I will mention that if your institution is interested in this course, this is what you would get. You would get everything. You would get all and completely free of cost, right? This was funded through federal dollars, so this is why we are able to, and we are happy and glad to be able to offer all of these resources free of charge. The syllabus for the course implementation guide. So there's like an actual guide for instructors about how to best implement this course, which type of instructor should implement this course, right, as well as which type of students. It just goes more in depth about how to actually implement the course. All research articles that are referenced in the course, all sample lecture PowerPoints, and it's a 13-week. I mean, this is what you see in the other colleges. It's a 13-week semester, 3 credit hour course, by the way, is how this was designed. All quizzes and exams and all sample projects too. There are some student projects as well. So all of the materials would be given to you all. There is kind of like an application kind of process. We'd have a conversation about who would implement the course, what it would look like prior to handing everything over. But again, once we got to that point, everything would be free. You would have the opportunity to consult with OSPF. It would probably be me on how to best adhere to the fidelity measures. Are you implementing this course to fidelity, right, the right way? Fidelity package suggestions and requirements, and you could consult with OSPF, or even the original developers have offered to just a little bit of their time too, if you want to talk directly to the folks that developed and implemented the course. And actually, talking about Kent State last week, we just handed everything over. Yes.
You said it's 3 credits?
3 credit hour. Yeah. And there is some flexibility, and we'll get into that when we talk about some of the fidelity measures too, right? We're not saying everything has to be implemented the exact same way that the original developers did. There are some, fidelity kind of areas that we are more strict on, some we're a little bit more lax on, and we'll have a conversation about that in just a minute. But now I'm going to play this course video, just a little bit of an overview. And actually, two of the people you're going to see here, Dr. Amanda LaGuardia and Dr. Jennifer Wright-Berryman from the University of Cincinnati, were among the original developers and implementers of this course. So they coming at it from a research standpoint and actual, professor standpoint. So again, that was just a little bit of an overview of the course, and we thought that both of the instructors did a good job there talking about some of the competencies and what students will learn and what the benefits are. All right, so now I'm just going to kind of walk you through a little bit more in the specifics of the actual content of this course. Here is the section of the syllabus about foundational competencies in suicide prevention. So this would be like the first section of the syllabus, first section of the course. So I probably won't read through everything just because I'm going through the entire syllabus here. But here you can see some of the competencies, actual suicide prevention competencies. Those are the ones that are just labeled competency. And then where it says IPEC competency, those are those specific interprofessional learning competencies about collaborating with other fields of study and other students. So again, in this section, it's just again kind of about basic concepts of suicide prevention, and then also when we get down to the IPEC competency, about ethical approaches and respect for mutual contribution for or to provision of care. So this is more of that tertiary prevention. So this would be again kind of one-on-one working with clients or patients. There's some IPEC competencies here about roles and responsibilities, about who needs to be involved, interprofessional communication, how do you work with one another, but also those specific competencies when you're working directly with patients or clients. So again, one of them being conducting and documenting a clinical risk assessment, and again understanding mental health service approaches to suicide prevention. So this is, that kind of secondary prevention stuff. This is probably the shorter section of the course, but, enacting a collaborative evidence-based plan and comprehending social support approaches to suicide prevention to those that are identified at the most risk. By the way, I see folks taking pictures. I think that the slides are actually already in the EADS platform. If you go there, they're already there. You can feel free to take pictures. I don't care, but I just wanted to let you know.
Is there also a website with all this information?
No, there isn't. I can connect one-on-one with folks though, and I'm happy to send over the information. So this is the community-based competency. So this is, primary prevention. This is again casting that wide. This is like the public health approach to suicide prevention, reaching as many people as possible. So here are some of the competencies here. I'll just give a moment so you can consume this, and then we'll switch slides. All right, so now I kind of want to switch gears to talk about implementing this course to fidelity. Again, there a lot went into developing this course. A lot went into tweaking the course after and making adjustments after implementing a few times at those various institutions. Both in person, hybrid, and online. So again, we like to ask folks to try to adhere to the best fidelity, principles as possible when implementing this course. But we also recognize that each institution is different, right? And you may need to make some adjustments, which is totally fine. So there is some room for flexibility. We'll talk about that here in just a second. And obviously implementation science and research suggests that higher fidelity programs have better outcomes. And goals for adopting institutions would be to, again, allow for adaptations. We actually do encourage some adaptations. And inserting the most recent kind of evidence-based resources, initiatives, programs, risk assessments. We know that the research is ever evolving, and every year there are new suicide prevention programs and resources. So we actually do encourage you to supplement those in, insert those in if necessary. And ensure resulting outcomes from course are in line with intended goals, meaning we do ask that institutions who adopt do a pre and post test with students. It is completely de-identified, right? We don't ask for their name. We don't ask for any demographics. It's more of, assessing did they actually, show improvements in knowledge, efficacy, after taking the course. Do they feel more confident when actually implementing suicide prevention initiatives, best practices, risk assessments? Do they feel comfortable working with other fields? Also, the actual instructor of the course too would do a pre and post survey too. Just kind of they would fill out where they think they fall in line with some of these fidelity measures we're about to talk about at the beginning of the course, and then where they ended up at the end of the course. And then if the institution wants to re-implement, in another semester, then they can have a conversation with OSPF or the developers about again how what are some of those lessons learned? How can we best support you? I'm going to go through some of those fidelity dimensions, and if you're interested in this course, I can actually send you the Word doc version of this with every single one of these charts. So there's some dimensions we're going to talk about in terms of fidelity. It's kind of rated on a scale 1 to 5, 5 being like the best case scenario. This is what we would absolutely love to see with each of these dimensions. But like I said, some of these dimensions are more flexible than others. You don't have to get a 5 for every single one of these to be able to implement this course. So personnel instructor expertise. So who's actually going to teach this course? In a perfect world, we would love to have an instructor that's a published researcher, right? Number of years in suicide prevention, knows all of the best practices that are out there. Also clinical experience as well, right? Working with patients and clients. But again, we know first off, we know that suicidologists that are that esteemed are very, far and few in between. So again, that's best case scenario. Here with this dimension, probably a 3 or 4 is acceptable. Just some, even a 3, right? Instructor has some basic knowledge of suicide prevention training, research, clinical experience in suicide prevention. Kent State, we're very fortunate. They're going to implement. They have somebody who's going to be teaching the course that does have that suicide prevention background. I kind of already walked through this. So again, this is best case scenario. This is just explaining this a little bit more depth about what do we mean somebody who is an expert in suicide prevention. So delivery format, so meaning kind of how are you going to offer this course? Is it going to be in person, hybrid, virtual? If it's virtual, is it going to be completely asynchronous? Is it going to be synchronous but live, right? Obviously the best outcomes were when the original developers implemented fully in person, right? With less than 15% of the content facilitated online to students. But again, that's not mandatory. I mean, the institutions that originally developed this course, again, are offering this in hybrid and even fully online. But it is not recommended to do completely asynchronous just because, again, this course, the interprofessional competencies kind of is a requirement, working with students together. So time and content, again, 3 credit hours is how this course was implemented at every single one of the institutions. I would say that this one is probably a little bit more on the stricter side just because you cannot get all of the content to students if you start reducing the credit hours. So I would say that for a 4 and 5 here would be what we're looking for.
Can you clarify? So that means that it can be all the way down to 3, but the preference would be 4 or 5, or?
Yeah. And again, I'm just giving an overview here. Like this would be like a case by case kind of, we would talk one-on-one about what the needs of your institution are, what resources you have available, what you're able to do to make these accommodations. And again, that's just kind of a case by case. I'm just giving a little bit of an overview of, in best case scenario of what we're looking for. And like I said, we have the ability to make case by case decisions too on any of these fidelity scales. It's just, we would prefer a 4 or 5 and some of these even 3, like the scale up here. So evidence-based materials, this is, a little bit more on the stricter side too. That's kind of a requirement to have evidence-based materials based in the most current literature. And this is what I mean by we do encourage you to supplement, add in, even subtract if, the literature that's referenced in the original course materials is outdated. Please update it. We encourage that. Again, materials need to be derived from the most recent relevant literature as at the time of course development or implementation. The original developers are actually working on every 5 years, so that's coming up soon. I'd say next year or 2025 they'll be updating the course and its materials, but it's still active right now, still relevant right now. Again, you can add, subtract, supplement any new or improved materials or resources. So, content and planning, right? This one, again, is a little bit more on the stricter side just because we want a wide variety of students of different fields of study involved here. There's no like hard and fast number of like, hey, we need like three different majors in this class, right? Again, it's case by case, but we do encourage a diverse group of students, both, well, actually, just in terms of field of study, but also different levels to undergrad or and graduate learning together. Community college obviously would just be kind of that undergrad level. That's totally fine too. That's not that part's not a requirement, but it is encouraged. So effectiveness and outcomes monitoring. This is the one where we can be really flexible. So there's only like a couple of requirements here. This is like what you would report back to OSPF. And by the way, interested institutions would, contract with OSPF. There'd be a whole data sharing agreement and everything like that. We would work through that process individually. We just, like I said, we just went through that with Kent State. But basically, what we would, at the bare minimum, the data that we would require is that that fidelity scale from the instructor, basically from their standpoint, a prior to the course launching. Do we think that we're going to implement this to fidelity? If so, what level, rate 1 to 5, each of these dimensions. And then at the end of the course, okay, now that we just implemented the course, where did we actually end up? And then rate that, report that back. That obviously won't be de-identified because it's the instructor teaching the course who will provide that information, but the student data will absolutely be de-identified and aggregated to as more institutions and more offerings of the course would be implemented. And that's just a pre and post test. And we would send that to you ahead of time too. You can certainly look at what that pre and post test would look like to know exactly what we would be asking for students. And, it's never we would never ask you to make it a requirement for students to participate in a survey. But if you do feel so inclined to incentivize them with extra credit or something, that's totally fine too. Okay, so this is the representation of IPE students. So again, there are like it says, if you look at the 5 scale here, students are from more than 4 fields of study and practice. Again, that's the best case scenario. Some institution, and we know that UC, they were able to get even like 6 or 7. But again, that is just best case scenario. And this could be like an individual conversation that we would have about how many different types of students, different majors, fields of study that you could get in the course. We would never want, though, students from every single one from the same exact major or field of study, just because, again, so much of this content is about collaboration between those other majors and fields of practice. This is the last fidelity scale here. So this is about accessibility. And I'm sure that your institutions, everything's run through, the office of like, accessibility. So it's, again, equitable, potential to accomplish learning objectives, right? So vetting that, all the course materials, and making sure everything's accessible to students with any type of disability. And this is one we're more strict on too, and the course developers made that pretty clear to me too, that they would like this to be accessible to as many students as possible. All right, so we're wrapping up here. How to sign up. So just reach out to me, the Ohio Suicide Prevention Foundation. We can set up an individual meeting. We can have a further conversation about this. I can give you a preview of some of the actual content. It says submit application. It's really not that serious, guys. We'll just have a conversation about it and see where where we think we can meet in the middle in terms of some of these fidelity scales. Is what you think your institution realistically can implement. And you can consult with OSPF. There's even an opportunity for the original developers to reach out to you as well on an ongoing basis, throughout the implementation period, before, after. And OSPF will provide the materials. So we're at the end. So I know that we are just at time, but there is that survey too. But as you're filling out that survey, and I think there's that QR code on those documents that I had sent out. If you haven't had a chance to scan that QR code, please sign or scan that, and that's where you can fill out that evaluation. But I will take questions now if you have any. I'll stay here until everybody leaves the room. Yeah, you can actually email me or also call. That's our office phone number there as well. Yes.
There was an email saying institutions.
Sure. Yeah. So it was an elective at the original sites that was implemented, and also at Kent State as well. I will have to double check. I'm pretty sure that's the case. Since we just came to an agreement with them, I have to go back and look here. But I believe it's an elective.
And are the course materials like a textbook or just reading
It's
materials?
just reading materials. Yes. Yeah. Yeah. So no cost. Yeah, for extra cost there.
Well, we're always trying to find ways for our students to access resources that are at low or no cost, so seems like price is right.
Yes, yeah. The biggest hurdles we've had is kind of at the administration level. At one point, we had like 16 universities interested, and then COVID hit, so that just kind of screwed up everything. But just kind of getting that admin buy-in, finding who's going to teach the course, kind of thing. But Kent State seemed to have zero issue adopting the course. All right. Well, again, I don't want to keep you any longer. It's 10:03. I know you probably have another session to get to, but thank you very much, and I'll stick around just a few minutes if anybody wants to come up and have a conversation. Thank you.